Don't have Island Health yet.
I guess we'll start with it.
Yeah.
Good morning, everyone, and welcome to the March 9th meeting of the Comox Strathcona Regional Hospital District Board. We're gathering today at the regional office in Courtenay, and I want to recognize that we are meeting on the unceded territory of the Comox First Nation, the traditional keepers of this land. I also want to acknowledge all the territories of the original peoples that different members are calling in from. Welcome here today, and thanks for making time for this meeting. We will start with adoption. Could you roll it up, please? Adoption of minutes from January 26th, moved by Wells, seconded by Grant. Any discussion? Seeing none, is anyone opposed to adoption? That is carried. And we will move down to reports, and we have the Community Services Hub report dated March 22nd for receipt, please. Moved by Grant, seconded by Wells, and over to staff.
Thank you very much, Chair and Directors, and I'll provide a summary of this report, and with the rest of staff, we're here to answer questions. As well, we do have members of Island Health that are on the line that can help perhaps answer some questions if you have them. The concept of a community service health hub for the Comox Valley was one of 3 strategic initiatives that was adopted by the board. Over an extensive period of time, they undertook assessment and analysis of options moving forward for the purposes and functions of the hospital board to support the health needs of the municipal communities and rural areas. The board at the time adopted 3 initiatives, and a report attached to this report and the proposed MOU outlines those initiatives. That included supporting a long-term care facility in Campo River. It included expanding the name facilities that would be supported in our rural areas and also providing additional money to them. The 3rd initiative, which is subject to this report, was a community health hub in the Comox Valley. In consultation with Island Health over a period of time, it was realized that one of the needs for the Comox Valley to improve the conditions of health and services provided to this part of the community or this part of the region was the consolidation of health services that are provided within our municipalities in a series of different buildings and such. The idea of a health hub is to bring those into a single facility and then provide better care and synergies with those services, and possibly provide the potential for additional services that might support those that would otherwise not be provided within the community. Before you today is a memorandum of understanding. It's not a commitment to construct this facility. It's a commitment for Island Health and the health board to move forward and advance the project further, bringing additional information to both you and Island Health so that the decisions can be made on whether to proceed and how to proceed with this. The memorandum of understanding outlines generally the intent of the project, but a great deal of background information and analysis has been done by Island Health to determine the types of services, their programming needs and requirements, and that will form the basis of us moving forward and providing more meat on the bones or description to this project to share with you in the future. We're available to answer any questions if you have them, and our recommendation is that you would adopt the resolution that supports the memorandum of understanding that is attached to this report, which will enable us to gather more information and work in cooperation with Island Health to advance this, your 3rd of 3 strategic initiatives as adopted by the board.
Thanks, Russell, and Director Grant.
Yeah, thank you. So I'm brand new to the hospital board, and so I'm really not super clear on what this hub is or what it is we're trying to accomplish here. There's a little bit of information here on it, but so I have several questions on what we're doing here, but I guess for the most part, and one part of me is thinking that this really feels like a bit of a download from the provincial government onto us. Like, I think if you look back at letters patent and when the hospitals were, you know, we kind of agreed to build a hospital and then it morphed into 2 hospitals. But I don't think the public would think that we were actually put together here to start building capital projects through this. I think if you ask them, they would say, no, that was there to just build a hospital. So I'm not, it's just because maybe it's my lack of understanding of how this all works. But I wouldn't mind knowing in a staff report just the actual history of how we got to where we are today and what our letters patent had to say, because it sounds to me like it's probably a good project. I'm just wondering why the province doesn't pay for this and why we're actually taking this on and having the homeowners of our communities take these kind of projects on when it sounds like it's like health falls right under a provincial mandate, and here we are paying for it. So maybe it's my confusion in how it all works, but you know, and I'm a little bit unclear as to what would go into this hub and what the purpose would be, and I'm not taking a side one way or the other. I just don't know.
Yeah, no, thank you very much for the question. And those questions and those considerations were given a lot of due consideration by the previous board. It was not a decision that they came to easily. But to answer your question, the authority that this hospital district has to undertake this is within the letters patent. And it has been proven that other communities across the province have undertaken similar initiatives where they've expanded it from the realm of supporting hospitals and supporting other named facilities such as a health hub. So it's fully within the realm of the board to do this. Some of the issues that the board grappled with is that this board has tremendous capacity. It has tremendous capacity to borrow and fund such an initiative. And the previous board really asked us to take a hard look as to whether this might compromise the need for reserves or funding future upgrades, maintenance, or other capital responsibilities you would have from the existing named facilities. And provided in the attached report here is some of that analysis that demonstrates the financial capacity without compromising the reserves that you will have in place in subsequent years when you might look at another major reinvestment in the hospitals, either in Campbell River or here in the Comox Valley. So you certainly have the financial capacity, you have the legal authority. And I might just refer to one of the Island Health representatives to discuss why Island Health might see partnering with you, the hospital board, to undertake this might be advantageous.
Would one of the Island Health reps like to speak?
Certainly.
Go ahead.
Dave Boychuk speaking, and I think I've met everyone here before. Apologies, I couldn't be in person today. I'm Executive Director of Capital Planning, Financial Projects and P3s for Island Health. Yeah, I think that our colleagues with you have spoken quite clearly about the capacity, and so it's worth noting that as well as this letters patent, of course, the Hospital District Act governs this. As you might imagine, the reason we are interested in partnering with you is quite simple. You've heard about the capacity, and for us, in terms of Island Health, there's, as you know, there's considerable demand for services, and there's a lot in this particular project. There's quite a lot going on, and quite a lot of value in co-locating some Island Health services, which we can consolidate into one location in this, with community services as well. Now, that said, capital is constrained for us, and it is constrained by the province. And I've said before, at the level of the province, capital is constrained because it is debt, which has an effect on the provincial books. And there's quite a lot in there because it's not just us in the healthcare system, it's everybody. And so this is a very effective way of continuing to move forward to serving the health needs of Comox Strathcona residents, and also making best use of what limited capital we do have. And quite honestly, leveraging the capacity that you have to best support the health needs of your residents. Hopefully that's helpful.
Thanks, Dave. We'll go to Director Arbor, who appears to be walking down a hallway somewhere.
Thank you. I'm calling in from FCM, and we actually just, anyways, I'll spare you the details, but we're talking about healthcare here as well. I just want to express my support for the Health Hub. I think it's really important for the Comox Valley. We have 4 or 5 really old facilities, and I think consolidating those facilities as per Island Health's plan will really help with integrated care and also create some nice synergies in terms of service to our residents. So I'm in favor. And to Dr. Grant's comment, I think it's I don't know if it's sad or not, but more and more you're seeing partnerships across levels, orders of government. And in this case, what we've learned too is there's a little bit of, I hate to use those words, but there's a little bit of pay to play, as we're seeing in the housing sector as well, where local government are asked to show their support for projects through financial contributions. And so there was, in prior discussions, there was a risk that if we didn't step up, maybe the project would not simply just not happen, because Island Health would not have the internal capacity to, as was described, to pursue it. So maintaining the requisition the same, no impact on taxes. Staff has come up with a really nice model to fund this, and I just want to show my support and hope that we'll vote in favor.
Thanks, Director Arbor. And
Mr. Chair, could you put me in line, please, on the speakers list, Director Wally?
Well, thanks, Director Wally, and I recognize that you're on the telephone. We'll go to Director Jolicoeur and next.
Thank you, Chair. Just want to start off by saying that I'm really excited to see this coming forward, and thanks to the Chair for briefing me as a new member to the board around the 3 priorities of this board as established in the last term. And appreciate the staff attaching the 2021 report as well to really provide some further context. I guess I've got one question for our staff and one question likely for Island Health. The MOU looks pretty standard, no major concerns there, but there is an aspect in the MOU that I am curious around in the comments around the establishment of purpose, scope, size. And so it establishes that the 2 parties, Island Health and this board, would explore that. Maybe can staff speak to what that process would look like? And just while I have the microphone, the other question that I have, and I guess this is the only real concern that I have, and I don't know if it was just a typo, but in the 2021 report and in conversations with members of this board and listed in Appendix A in the 2021 report, which is not listed in Appendix B in our current report, is mental health and substance use has been removed from the report that we're considering today, the 2023 report. And so I'm wondering if folks can speak to that. And of note, I've noticed the addition of leadership and administration to this list. And I will just note that the idea of having upper management in a community-facing facility that's newer, presumably prettier, rather than client and patient-centered services. I think I'll just say that my priority is that there are services that are serving the public, and that upper management at Island Health is in fact potentially not considered in this service hub. So I guess a few comments and some questions.
Thank you very much, Mr. Chair. I'll start and then I'll refer to the Island Health staff to help in the response. And just for the Island Health staff, the question is referring to the list of potential services that has changed. And for the information of the board members, on Appendix B of the current report, it lists the type of potential services being home care nursing, social work, geriatric specialty services, consult teams, leadership and administration, palliative and end-of-life care, case management, community rehab, home support, and community resource team. And that's the best information that we have at this time. We will be working with Island Health to further this and confirm what will be included or not in the programming requirements and spatial requirements. Some of that work has been done and shared by Island Health with us, and we certainly will keep you up to speed as things advance and what will or will not be included. That's the basis of the MOU for that information sharing. And if I could just ask Island Health maybe to comment why some of the services that were previously considered around mental health or otherwise aren't included on this list, because I think we developed this list in association with you, Diane, and Doug.
I'm certainly happy to speak to this point. There's no, certainly, Director and members, there's no purposeful exclusion of mental health services. We also recognize that there's quite a lot in that piece. And so as has been suggested, this isn't a finalized list as of present and doesn't, so may not reflect the final composition. I do want to address head on the idea of senior management in the facility. I can say, Director, that your guidance is very much consistent with our own direction, and that is direct from our own CEO. We don't have an interest in putting senior administrators in clinical space. That's not something that we have an interest in doing. So to the extent that administration and leadership is there, that would be functional unit level leadership we are talking about.
Thanks, Dave. Good morning. It's Diane Mackay, also from Island Health. I'll just expand a little bit on the mental health substance use. When we worked with the program, they have a space downtown, and when we were working through our functional programming, they've indicated a strong desire to maintain their existing location and consolidate their services in that existing location. And because that is where their client base specifically is situated. And because we understood through functional programming that we likely wouldn't be able to accommodate all of our programs, we did have to go through a prioritization process. And when we were speaking with our colleagues in mental health, their preference was made clear that they would prefer to stay in their existing location and continue to expand their services and programs in place.
Thanks for that, and we'll turn it back to Russell Dyson for the Director Jolliker's other question.
Yeah, I think Director Jolliffe, if I'm correct, you were wondering about process and next steps, and with the MOU supported by you today, the next steps will be for us to meet with our municipal partners and see about the availability and appropriateness of space. That will very much help Island Health and ourselves refine the program and inclusions of facilities and the spatial needs and what can be accommodated. So there will be outreach to municipal staff to get their input on this. And ultimately, much of what will be realized in such a hub will be dependent on the availability of built space within the requirements of Island Health's needs in terms of location and access.
Thank you. And next we'll go to Director Chapman.
Thank you, Chair. I noticed in the staff report, November 10th, 2021, it outlines that a lot of the services for a senior's retirement will be in Kemp River, and lab items for the hub will be in Comox or the Comox Valley. Have I read that correctly? Are we going to separate these functions because we appear to be lacking lab resources here in Campbell River, where it seems to be centralized and focused in the Comox Valley? Am I misunderstanding this? Can you clarify that, please?
When it came to the priorities of this board and what it saw the best investment in, it recognized that the needs within the Campbell River area and the northern area were different, in that the most pending issue with you being able to affect services would be to invest in long-term care, which would then help free up space and services within the hospital within that area. That was the most urgent need. And if the board decided that if it was to invest in something in the north that had the biggest impact, that was it. And then the circumstances here in the valley were a little different in terms of the health hub being much more prominent as to the most effective means of helping to invest in services here, all of which do have an impact and effect across the entire region for sure. Your question was specific to lab services, maybe something that's central to the operations of the hospital in there, and maybe a little bit separate from the consideration of the investment or what would or would not be included in a hub. Am I correct in that, Director Chapman?
it appears we're separating services again. We serve this a wide area up here in Campbell River, right from northern part of the island across the west coast, and I appreciate the support we give to the outlying communities for their clinics, but I think we may be missing an opportunity to provide more equal services to the both the regional districts, the Strathcona Regional District and the Comox Regional District. I know for health purposes, we're the Comox Strathcona Regional District. I understand that, but it appears that, and I agree, we need retirement facilities here in Campbell River to free up space in the hospital. And I'm fairly sure that's the same for the Comox Valley. But yet it's not mentioned in that's an old report. I know that, Mr. Dyson. I'm not trying to split hairs, but I think we need to be careful when we align and sort out the services to each area, that we try to keep it more or less equal, including lab services. Thank you.
Thanks, Director Chapman. And Max Dukowski from Island Health would like to respond.
Yeah, thank you very much. I think those are really fair points and great questions to be made. Within the Comox Valley, just a little bit of background. We have outpatient lab service within the hospital, and we also have outpatient lab services within 3 community sites. Due to the international scarcity of lab technicians and lab staff to be able to draw samples, those sites have closed, and we've consolidated our staff at the hospital within Comox Valley. We also provide outpatient lab services within the Campbell River Hospital as well. And traditionally within Campbell River, that hospital has been able to serve the community, that outpatient lab within the hospital, quite well, and has been able to provide consistent service to the community out of that site. Moving into the future, when we look at consolidating and coordinating and harmonizing our services under the Community Health Hub within the Comox Valley, which is a very exciting project that has a lot of promise to be able to better serve the community and improve outcomes for the community. The outpatient lab building that is in the downtown area of Courtenay is targeted to be part of that integration into the Community Health Hub. So we're looking at what can we do with lab services to be able to provide more wraparound supports for individuals through that health hub. So that's why you see the outpatient lab service included in that. It's taking the lab service that we have within that area and putting it part of the overall hub.
Thanks. And we do have a number of speakers, so please be assured that we'll get to you. Next, we have Director Wells.
Thank you, Chair. I am the alternate for Councillor Cole Hamilton today, and so I'm sort of getting up to speed on some of these things. I do want to reiterate and maybe support some of the comments already in terms of Director Arbour and the fact that if we come to the table not just with intent, but with dollars, we've seen that be extremely effective, especially if we look at a project like the water treatment facility, where we brought $30 million and we're able to get over $60 million in grant funding. So that certainly has proved out to be a way to show up. And unfortunately, it does probably reinforce Director Grant's thoughts that, it's downloading, because frankly it is. But at the end of the day, if we want to be effective and have results, we're really competing with other municipalities and in this case, hospital districts. So, if we know what the recipe is to win, unfortunately, to me, that this is one of the things that we have to, I don't know if you want to call it modernizing, but we really have to change our thinking to a certain degree. Also on the labs, really happy to see increase in lab services. And I actually believe we have a letter regarding that today as well. And My question though, two questions. One is really having some sort of timeline, we're going to have a memorandum of understanding, but really that end result, realistically, I know we're on island time, but what can we expect to see in terms of deliverables? And then the second thing is as always, looking for opportunities for integrating reconciliation into something like this, especially given the large dollar amount, which again, I think will attract more provincial funding. So that's my two questions.
Thanks, Director Wells. Would somebody from Island Health like to respond on the timing and the reconciliation aspect?
I'm happy to speak to the reconciliation piece very briefly, which is to say that is very much also part of Island Health's operations in all things that we're doing. And so we here understand and accept that, and it will be a part of our planning. And I would defer to my colleague Diane Mackay as to timing.
Thanks, Dave. I think we would several of our leases that we have currently are coming up for expiry this year and next year. So we've always understood that we're either going to need to find temporary space for some of our programs or extend our existing leases. But from our position here, we'd like to be able to proceed forward as soon as possible. And appreciate the opportunity to have this partnership with the hospital district.
Thanks very much, and we'll now go to Director Wally.
Would I be able to do a subsequent or real quick?
I'll ask you to wait, given the number of people in line. Director Wally, please.
Thank you, Mr. Chair. Yes, I'm opposed to this hub as I was to the long-term care facility in Cameron River, simply because, as has already been mentioned, this is simply a download from the provincial government. I don't believe that the end justifies the means in this, as well as in anything else as far as that matter goes. Now, the history of this is that we increased requisitions for our constituents to build that new hospital. When it was built, we had a surplus. Rather than return that money to our constituents, the board decided that they would go ahead and do this long-term care home. But the province has unlimited authority and ability to requisition whatever amounts of money they need to do whatever needs to be done. And once we begin to subsidize the provincial government, there's no end to this. This is just the narrow sort of the wedge. And the other point that I would like to make is I don't see Island Health as a reliable partner, and I look at what they have done to the pathology lab in Campbell River, and I would just rather this be a provincial initiative. They know what needs to be done, and they have the ability to do it. Thank you.
Thanks, Director Wally. We'll now go to Director Kerr.
Thank you, and it's a tough act to follow, but I will do my best. I'm in support of this community health services hub concept. Community-led initiatives provide better community care. We know that from the research. And when we look at a healthy, well-resourced hospital or hospitals that we have, they depend on strong community health services. Without it, our emergency room becomes even more overcrowded, beds become full, and there are implications on patient care and staff morale. In Campbell River, those long-term care beds being created will help on the back end, ensuring that there are places for alternative level of care patients to go, taking pressure off the wards in the ER. This community health services hub is focusing on the front end, the front door of the hospital, reducing the number of ER visits, admissions to hospital, and bounce back readmissions, by providing a higher level of care in the community. So I'm also really happy to hear from Max that lab services are a component of this, as that's the biggest need that I find for my patients right now, getting blood work in a timely manner. So two questions I have. One is about language. The documents refer to this as a community services hub. I'd really prefer that the memorandum refer to it as a community health services hub. This is a healthcare project. We should have the word health in the name. Community services is too broad and could be interpreted now or in the future by the public or other boards as something more broad. So we're focusing on health services from this board. So I'd like to suggest that. Also, this is a question for one of our Island Health representatives. Earlier this month, I attended the advisory committee of the Division of Family Practice here in the Comox Valley. We're talking about this journey that Island Health and the division are taking to create an urgent primary care center. So this would include an after-hours clinic and other primary care services. And here at this board, we're looking at this community health services hub again with our friends from Island Health. These are two parallel processes. They're working on very similar patient populations and outcomes to take pressure off the hospital. I'm wondering, and I asked it at a prior meeting, I'll ask it again, how are we going to bring these two parallel processes together? Is now the right time? Is it in the future? I would hate to get us to build two new facilities that are really doing very similar work. It makes sense for the synergies for these to come together. And along with the primary care network that's also being developed here locally with social workers, mental health counselors, clinical pharmacists, nurses, et cetera, providing outreach to the family physician clinics. That would also be a nice synergistic approach to incorporate that into this renamed Community Health Services Hub. So thank you.
Mr. Chair, I'll answer the first question. I think it's the toughest, and that's to say that there's no objection if you in your resolution rename this and put health in that. And I can assure you there's no ice rigs or otherwise planned for the facility. And then maybe just ask Island Health to tackle the second question that Director Kerr asked.
Someone from Island Health, please.
Yeah, I can jump in. Dave, feel free to follow up. Same with you, Diane. Yeah, really excellent comments. I will comment on the title. And just want to say thank you for providing those expert comments as well. Yeah, definitely agree with the title. It could even be expanded further as a health and social services hub, where we can add some of those social components as well. In terms of the planning, absolutely. The vision we want to be able to move forward to is exactly that, is to be able to look at the work that's happening through the division in terms of moving forward with urgent primary care clinic and having that as a component established within the community health hub. It makes a lot of sense. In our planning and our timelines, when we were moving forward with understanding our functional design and what our needs are into the future and building out what our programs will need to be into the future as well, and the growth around our staff and community services that we're going to be able to provide. We did include the feasibility of the urgent primary care clinic within that, but the timing didn't align because the division was still moving through its decision processes around the need or the endorsement of a UPCC within the Comox Valley. Now that the division has made or signaled direction on that, we absolutely want to be able to work to be able to integrate that overall in the health hub as you described.
Thanks. And does anyone want to object if we add the word health to, well, we'll do that when we get to the recommendation, and we'll move to Director Morin. Director Morin, would you like to unmute?
Sorry about that. I was trying, but unfortunately, I'm having a bit of a technological issue here. Hopefully you can hear me. Can you hear me now?
Yes, we can hear you.
Okay, thank you. Yeah, just sorry. Thank you for, it's a bit difficult to follow along online because I think the speakers list, you know, we don't have access to what's going on in the room, but in any event, yeah, just going back to a couple of the comments that Director Jollicoeur made and also Director Wells. I'm wondering if there could be just an answer around the substance use and mental health. I did hear the answer that it completely makes sense looking at client needs and that kind of thing. But substance use and mental health was featured pretty heavily in the original conversation. In fact, it's throughout that document. really focusing on those aspects. And currently, there are several locations to access mental health and substance use services in the Comox Valley, and it is problematic for people. And I guess I'm just wondering what the plan is for consolidation, because it sounds like there is some plan to consolidate those. That's sort of separate from this process, and I guess I'm wondering the rationale for that. And just in terms of the reconciliation piece, I'm wondering if there is a specific intention to locate some fairly robust First Nations health services with the under the First Nations Health Authority or something like that, where there would be a really accessible location for folks to go. Those, I'll start with those. Thanks. I don't know what the rest of the list of speakers is, but.
Mr. Chair, I'll just refer to Island Health to answer the questions with respect to the programming as asked.
Certainly. So thank you, Director. You've heard that we ultimately, of course, we need to find a way to serve our clients where they need our clients and patients where they need to be served. And so you heard our colleague Diane speak about the desire for mental health as that suite of services currently exists to be located in a central location where they can best serve our clients. So that's certainly part of the discussion. Further to the other discussion that we've already had, there's nothing that precludes, and certainly not in our thinking, that precludes the location of some mental health services in this space. So no concerns that we're simply walking away from that. Only to say in the current iteration, we understand we have very clear feedback from our clinical folks on this point. As to First Nations health, as I say, this is something that certainly Island Health thinks about all the time, and we have a relationship, of course, with the First Nations Health Authority as well. And I might look to my colleague Max to add anything that he wants to add there.
No, absolutely. Yeah, it's a critical component of our work. So as we start to progress and move forward, we want to ensure that we have some strong engagement with Indigenous communities and our Indigenous partners. We work with our Indigenous health portfolios within our organization. I work in what we call a triad relationship with Dr. Dieter de Bruin and Mary Knox. And the triad includes leadership for Indigenous health. So as we progress through this program, we absolutely want to ensure strong partnerships with all of the community providers as we build out what the future would look like for a community health hub.
Director Morin, did you have another point?
Yeah, I guess just to say that on the list of services, there's a potential services. There's a combination of services that clients directly access. And then there's things like home support and things like that, and public health, which have more of an outreach component. And I guess I'm wondering what the weight is there if the rationale for consolidation in the old report, it says more optimal health outcomes, especially in populations that have lower socioeconomic status. And I guess I'm really speaking to accessibility, and particularly for those folks that have huge barriers and sometimes also are released from hospital because they need to be released because of space and other things, but still come out with some acute care type needs, even though they may not be as high priority in acute care. They still have they really need a place to go to have that aftercare. And I guess I'm wondering what the weighting is in terms of direct client care with this consolidation, as opposed to having offices that meet the needs of consolidating for Island Health and having everything under one roof and the efficiencies with that. I'm really advocating, I guess, for that real accessibility and meeting the needs of the folks who are really struggling with the system as it is. Thanks.
Thanks, Director Morin. Any follow-up on that, Max or Dave?
I'm happy. Thank you, Director, for the and Chair for the opportunity. So please rest assured, Director Morin, that accessibility is a front piece of all of the discussions as we move through this process. That is absolutely something that we are focused on. And I would come back to something that I've said earlier, but I'm happy to reiterate. Certainly in terms of our planning, well, I couldn't speak to a waiting because we're early in the planning process. What I will say is our primary directive is always to have clinical operations in clinical space. We are not looking to wait towards purely administrative functions in the space.
Okay, thank you.
Thanks, and we'll go to Director Baker.
Hi, thank you. I'm also new to the board, but I guess part of the concern, I understand how we can expedite this process by this board getting involved and getting money for this program. I do understand also the provincial government is getting a little bit more money from the federal government for healthcare as well. And I am concerned, as I share some of Director Wally's concerns, is for the provincial government should be funding this, in my opinion. There's no question. And if we do this, are we setting a precedence going forward to where the federal government or the provincial government can pass off their responsibility and pass it back to us? Thank you.
Mr. Chair, no, you're not setting any precedent. Ultimately, it is up to this board to determine what it's prepared to fund, and that rests with you, the board, and it is subject to those being named facilities as well. So there's a process of consideration that's done in consultation with you, the board.
And back to Director Wells.
Thank you, Chair. And yeah, just like I said, I just kind of wanted to follow up a little bit. I appreciate the Island Health's feedback there. And one of the comments really just, again, following Director Baker and others around the challenges around this downloading cost, frankly, that's happening. And it's certainly something that I'm concerned about. But at the end of the day, to not do it feels for me almost like cutting my nose off to spite my face. If this is going to get us where we need to be, unfortunately, as much as it frankly sucks, I'd rather be able to have results at the end of the day than to say, we stood up against the province, because I think, again, they are looking for those partnerships, I'm often baffled as to, they'll give you grant money and then you use it with them and all that kind of stuff. But, it's all for sometimes a photo op, I guess, at the end of the day. But if we can get those results, that's critical. The second thing really is when we have that memorandum of understanding, given the comments that have been made, just making sure that we do embed reconciliation as part of the tenets of that, I think is absolutely critical. And going back to the previous one, and maybe staff can comment, this is going to come back to us. There's going to be recommendations and reports on those funding arrangements. And so, I feel comforted by that, but I don't know if staff want to speak further to that side of things.
Yeah, absolutely, for sure. There will be a series of subsequent considerations by this board to move the project forward. Today, you're just agreeing to work arm in arm with Island Health to get the information together, to do more analysis, to talk to our municipal partners, and advance this with more information for you to make those decisions.
Thanks, and Director Jolicoeur.
Yeah, thank you, Chair. And just as a follow-up to community partners, it's listed a few times in the staff report around obviously our municipal partners. There's some language here around downtown Courtney, and there's some language here around other services that could be co-located. And so I guess I'm curious around what that process would look like. I imagine that would be potentially other services that provide health and social services, maybe our nonprofit partners in the community. And I would allay just Director Morin's comments. You know, when I read the 2021 report versus the 2022 report, there was a significant emphasis on people with mental health and equity challenges in the 2021 report, where that wasn't necessarily the lens that I read our current report. And so I did want to just, you know, again, share my support to ensure that those considerations are included. I think that really adds to what we're hearing on the ground here in Comox Valley around service access. My last question for Island Health, from a higher level, and this is probably for Max, from a capital expense, you know, if we move forward and this is successful today in our consideration to move this project forward, other potential capital projects that Island Health is considering in the Comox Valley. We had at our council meeting with the city of Courtney last night, the medical officer for the North Island and the director of MHSU here. And we've been pushing for substance use services, increase in substance use services in the community. And I just wonder if you can speak to any potential impact that a larger project like this, financial impact, resource impact, would have on Island Health's capacity to say yes to either upgrades of existing services from a capital perspective or new services like the one that we're pushing for and that we had a delegation from Island Health on last night. What I wouldn't want to see is this moving forward having a negative impact on potential future or other projects that are on the docket that might not be coming forward to this board, but are on the work plan for Island Health. So I'm wondering if you can speak to that.
Thanks, Director. I'm happy to jump in on this. This is sort of because capital is really part of my portfolio, and so happy to speak on this. So we operate in a constrained capital environment, and so this is an effort to add to what we can do in the Valley by way of a partnership that we're quite grateful for with you. This doesn't detract from anything else that we were doing. And it does help us with capacity because it is then something that like this in overall improves the capital envelope that we have in the region. So it isn't a detraction. It isn't a replacement. This is work that a novel partnership allows us to do in addition would be the best way of looking at this.
Thanks. And we'll go to Director Grant.
Yeah, thank you. So I think a lot's being made of provincial downloading onto us. And it's not just happening in this case, but it happens in just about everything that we do these days. You know, I jokingly say that I think at their Christmas parties, they try and figure out what they can dump on us this time. But I think these are frank discussions that we have to have with the ministers. You know, it's all great for the province to, you know, to download this stuff onto us. And then come in with a $2 billion surplus while the communities are all looking at 10 and 20% tax increases. And I think that we need to really sit down frankly with the ministers. I don't think it's the health. I don't think Island Health really has a lot of say in this either. They talk about their constraints with capital funding. And I think we as communities really need to talk to our ministers and our MLAs about what they're doing and how they're downloading it. All you have to do is look at Abbotsford to see what happens when you download things onto communities they can't afford to handle. So I don't have any real problem with the memorandum of understanding and getting more information on it, but I think that we really need to be vigilant on how much we're going to accept on downloads.
Okay, thanks for those comments. I think it's time for us to move along, and we're on receipt of the Community Services Hub project. All those in favor? And are there any opposed? That carries. Would someone like to move the recommendation with the inclusion of the word health so that it reads of a community health services hub.
Move it.
Moved by Kerr, seconded by Mawhinney. Further discussion? All those in favor? Are there any opposed? That is carried. Whoops, where somebody, Director Wally is asking to unmute. Director Wally, are you registering your opposition?
To the first motion, yes, the internet came on and my phone went off, so I would just, if you would just record me as opposed to that initial motion to change the name, I'm in favor.
All right, so you're voting against receipt?
No, not receipt. I guess the community health hub project motion.
Okay, you're voting against.
I voted against that. Thanks. Thank you.
Okay, thank you. The motion is carried, and we'll move on to item 2, which is the recommended budget. A motion for receipt, please. Move Wells, seconded Grant, and over to staff.
Thank you, Chair and Directors, and Kevin Duval is here to present the recommended budget for the Comox Strathcona Regional Health District.
Thank you very much, CAO, through the chair to the directors. Good morning. So staff are here today to provide the 2023 recommended budget for the hospital district for your consideration and adoption. As you may recall, back in December, we brought forward the provisional budget for the regional hospital district, and that was adopted at that time. And that is part of the legislation to enable us to carry on with regular business as we move through the annual financial planning process and look forward to the March 31st deadline when we do have to have the formal adoption of the financial plan. The 2023 recommended budget presenting to you today represents a relatively status quo budget, similar to that outlined in that provisional budget back in December. Exceptions to this, of course, include the addition of prior year surplus and also inclusion of the Island Health annual equipment and project requests, which is attached as Appendix E to the staff report in your package. The recommended tax requisition for 2023 is 12.6 million. That, of course, remains unchanged from both 2021 and 2022. This results in an estimated residential rate per thousand of taxable value in 23 of 0.2599. What that would equate to for a home assessed at $850,000 is about $221. If your home were assessed at $550,000, that would equate to a tax impact of $143. We've also provided some subsequent options for your information in the staff report as well. Based on that, the participant apportionments, which are provided in Appendix A, have been updated and reflect utilizing the 2023 completed assessment roll, which we received back in early January. These will be recalculated one last time as we receive the 2023 revised roll in late March, and then that will set those apportionments to all of the various participants. The total overall 2023 recommended budget sits at 15.3 million, which is 366,000 greater than in 2022, which was sitting at just over 14.9 million. The annual funding allocation of 1.85 million for minor capital or minor equipment and projects continues. That's the same as it has been for the last number of years. And once again, is funded entirely through the current year tax requisition. That also does help support the Island Health project requests that are again included in your package. Also included in this financial plan are the unconditional grant amounts to the rural facilities. As you may recall, the last board back in 2021, we were currently at that time providing $5,000 per the 6 facilities or 6 named facilities that we were currently supporting. For 2022, that was increased to $10,000 per each named or designated facility. What we have included in this year's financial plan is a total of $120,000 that will allow us to continue to support those currently 6 facilities. And just for the benefit of the board, those are Cortez, Gold River, Cayucot, Sayward, Tassus, and Zavelis. And then we've also put forward, as indicated in the November strategic planning report, a number of other facilities for consideration by the minister that could potentially be further named or designated facilities. So we do have about $60,000 to potentially support those once we get confirmation of the facility, any additional facilities that are to be named. The annual MFA debt servicing continues to consist of 7.9 million in principal payments and 2.9 million for interest. That's primarily for the North Island Hospital project, although there's a little bit of residual left for the former St. Joseph site. And that last one does actually come due and expire in 2026. The 2022 surplus, as indicated in the report, is 2.2 million, and that does include 2022 unallocated annual capital project funding of about 577,000. Part of what's helping fund that is interest income. Interest income ended up being about $596,000 higher than what was forecast in the financial plan. Couple last points. A future expenditure reserve contribution in 2023 has been updated to now 2.2 million. That has been incorporated into the recommended budget and is nearly fully funded by that prior year surplus carry forward. And lastly, the total future expenditure reserve balance at the end of December 2022 was estimated to be to 26.8 million. Is noted again in the staff report, and that does include $5 million for previously identified Island Health projects and equipment, with the remainder about 21.7 million being available for the board to consider any future priorities and initiatives, such as the ones we're just spoken to in the previous staff report. So I will leave it at that and certainly welcome any questions.
And thanks, Kevin. And we'll go to Director Wally.
Thank you, Mr. Chair. I have a question about the total amount of requisition. I'm just curious, how much would the maximum amount of reduction we could make to the requisition be if considering we reduce reserves and did not fund these capital projects of the long-term care home and the health hub? What would be the maximum that we could reduce that requisition?
Through the chair to the directors, I mean, we would certainly have to get back to you with such analysis. At this point, as was spoken to in the previous report, the analysis that was done back in 2021 showed that there would be no impact to the current requisition level and that we would be able to support those projects within existing reserves. We are always cognizant that we're also having to look forward to any future considerations that this board or subsequent boards may be looking at in place with services that support our two existing hospital facilities. As you may recall, I mean, back with the North Island Hospital project, our requisition was 17 million. And then once that project was complete, we did bring back some analysis to the board and the board did endorse reducing it from that $17 million level down to the current 12.6.
If I might, Mr. Chair, I understand that these capital projects are taken from the large surplus that we had, but if we didn't have the need for that capital expenditures, that money could be returned to the taxpayers or requisitions could be reduced to on a much lower level. And that was my main part of my question. I understand you wouldn't have that figure in front of you, but perhaps you could provide it. Thank you.
Thanks, Director Wally, and we'll go to Director Joliker.
Yeah, and thank you for the presentation. A few questions. There's indication of surplus here. Has the board established a surplus policy? And I guess, Director Wally kind of alluded to surplus, and I wonder if this board has ever considered a conversation around what we would do. And in this case, from 2022, it looks like we had a surplus, what we would do with the surplus and how we would allocate that. I mean, presumably it's just going into reserves, but I'm wondering if there's actually been a conversation around what happens when we do get a surplus at the end of the year.
So through the chair to the directors. So no, at this point, we don't have a formal, policy that really drives that discussion. At this point, you're absolutely correct, as alluded to in the staff report and my presentation. The lion's share of that surplus is currently slated to go into reserve to fund any future projects that the board may consider. At the CBRD level, we are looking at implementing some policies around those types of items around reserves and their purpose. And how those things would work, but we haven't certainly entertained that discussion, at least at this point, at the hospital district level.
Okay, thank you. As a second question, Mr. Chair, if that's okay.
Carry on.
Thanks. In the staff report in Appendix D, it from November 2022, It indicates professional fees of 20,000 for strategic planning and board orientation and 15,000 for additional liaison or study work. Can you maybe speak to those two items? And I don't quite see that in the budget as proposed. If you can just maybe bring my attention to the budget line that those two numbers would be in Appendix B of our recommended budget.
Certainly. So again, through the chair to directors. So yeah, we do tend to allocate those two items annually within professional fees. One is to support any work that the board may wish to undertake over the course of the year with respect to revisiting strategic plans or updating those models or including other items. We do then allocate a small portion of allowance in there as well in case the board wishes to have us undertake any other strategic or analysis that would require outside consultation to help support that.
Thanks. And Director Grant?
Yeah, thanks. I'm just wondering, do we have an asset management plan for our hospitals and the capital projects that we're doing? We're paying these hospitals off at a very rapid rate, I would think, which is good. But if we got that asset management plan in place for future.
Through the chair to the directors. So at this point, I probably would need to defer to Island Health, given that none of that capital is actually a hospital district asset. So really, we do look to Island Health to ensure that the asset management plans are in place for certainly the two facilities and also with respect to any of the capital improvements that are made thereof.
I'm happy to speak to this point if that's the will of.
Yes, if you can briefly, Dave, thanks.
Very much so. So to the question, yes, of course, capital asset management, sustainment and replacement is an absolutely crucial and routine part of our capital management process throughout the portfolio, including for the two hospitals in Comox Valley and Campbell River. That process is robust and it is annual and ultimately is approved by our board and starts at the level of the units and works its way all the way through our executive leadership for board approval, and of course is driven by clinical. So yes, we are very much involved in that.
Okay, thanks for that. There's no further questions. So we have Director Moini.
Thank you, Chair. This is actually probably not quite a question for the financial guy, but I did notice that in the recommended budget, it states that should status updates be requested on any Island Health projects, a request could be made to have Island Health provide the information. And I'm curious because for the people of Quadra Island and the Discovery Islands, the annual $10,000 funding for named facilities will certainly spark beneficial projects. And I would like an update from an Island Health representative about the status of the proposed named facilities. When could we perhaps expect this decision and hopefully its approval? And I did notice that the $120,000 is in the budget. So are we prepared to make that as like a one-time allocation to the proposed facilities if in fact they do not get named in this budget year? Thanks.
So, Mr. Chair, a representative of Island Health might be able to update the board with respect to the naming of the facilities and the status of the naming.
Sure, I'd be happy to. Thank you. It's Diane. We're currently working with the representatives from the Regional Hospital District to clarify some questions around the designation of the sites requested. We've submitted the initial request to Ministry. They've come back with some inquiries and some feedback. And so we're currently working with the RHD to clarify some of that. And we will resubmit to the Ministry once we've been able to answer all of their clarification questions. So hopefully within the next few days. For how long it will take for them to approve it, I can't provide a timeline on that because I don't actually have any control over how long they would take that, but hopefully it will happen in due course.
Thanks. And as to the question of if the facilities were not named, I think we're fairly confident they will be. But if they weren't, you're asking, would the money still go for this 1 year? Yeah. Kevin?
I can certainly speak to that through the chair to the directors. So the amount of $10,000 that's provided to the current named or designated facilities is outlined as per the hospital district's financial planning policy. If for some reason for additional facilities weren't named or designated in this year, certainly staff would come back to you and look to some direction as to what you may want to do with those residual dollars that continue to be in the current financial plan.
Thanks very much. So then that we have Director Hardy.
Yeah, so sorry, I did read the reports and stuff, and again, just maybe it was in there and I didn't see it, but in regards to the consolidation of these services or consolidation of a building for all these services, is there going to be an increase in professionals in those facilities? Like, I guess my concern is if we're spending money on the asset, but we're not the human assets that are really what we really need at the end of the day. Is there an increase in the human assets with regards to this particular project at the end of the day? And if so, what is that increase? Is it, 10 more full-time employees, working at these facilities?
So I think you're back to the question of the hub. And I don't know if anybody from Island Health wants to comment on that. Whether if facilities are consolidated, there would in fact be any increase in staffing that would go along with that.
I think that's a best question best responded to by my colleague Max.
Thanks, Dan.
Yeah, absolutely. So as we performed our initial functional assessment, we know that for us to be able to continue to grow services within the communities, we need to be able to look at growing services in a way that helps support people within the community and prevent the need for higher levels of care, such as the need for hospital-based care or emergency department care or care within facilities. So as we look to be able to build out our programs, we are looking to grow our programs within the community, grow our programs with home care services, primary care services within provided through our social work teams, our pediatric teams, and we definitely are looking at expanding and growing those programs within the community, which would lead to expanded growth in what we currently are able to provide for the facilities in which those programs are offered within.
Director Hardy, follow up.
Thank you. So again, I'm just trying to understand when we say increased programs, if we're increasing the programs, I'm assuming that there's going to be an increase in full-time employees, human assets to be able to enhance those programs or even carry on those programs. So again, I'm just trying to understand, and maybe we're just at the beginning of the stages here, but I'm trying to understand if we're going to make an investment of several millions of dollars, is it in the best interest to buy a building, or are we better off to have that investment in the human resources that are going to put forward or enhance those programs at the end of the day? Like I'd like to see a clearer picture or more transparency in regards to the human assets component of this project moving forward, and then understanding what the budget's required for that as well.
Mr. Dyson?
Yeah, Mr. Chair, in the interest of considering the financial plan, which is the topic, I can commit to working with Island Health through the Health Hub MOU to come back with more information with respect to confirming, human resource assets or otherwise through that conversation and reports back to the board.
Thanks for that. Okay, we're on receipt of the recommended budget. All those in favor? Any opposed to receipt? Director Hardy, you're opposed? We're moving on to the recommendation, so I can put you on the speakers list for that.
Again, I'm in opposition right now, so I get questions answered then. Because
Okay.
again, I don't want to feel like I'm being confrontational here or anything, but again, we're talking about a budget. And here's a budget that's going to be, you know, we need to requisition X amount of dollars over the next few years so we can develop an asset that's going to provide a great service, hopefully, to all of our communities. But again, we're still passing a budget not knowing that picture with regards to the human assets. Like, where does that fall into this picture at the end of the day?
Well,
And maybe it's a private conversation that I can have with you later on, Kevin, that, you know, you're dealing with ecologically not so smart over here. But like I said, if we're voting on a budget and we still haven't incorporated the human assets component into this thing, is it something that we need to consider or not? And what I'm hearing is, don't worry about it now, we'll worry about it later.
Mr. Chair, it's my suggestion to report back, not to avoid giving you the answers you need, but there is nothing in the budget that reflects human resource. We don't pay for human resources. The budget is strictly the capital commitments that the hospital district makes. You are right. As we invest in capital projects, there is a human resource component that Island Health is responsible for funding and ensuring and hiring and managing. And so to help you and the board, we will ensure that that is part of the health hub matter and report back. But right now the board is grappling with its responsibility, and that is just the capital component. So I don't want to confuse the directors or the public that you have any authority or consideration over operations and human resources. That's not part of the budget, and that's not part of what you pay for, which is the debate right now.
Thanks for that. And we have passed receipt and we have a recommendation. Would someone like to move the recommendation? Moved by Wells, seconded by Sullivan. And is there any discussion? Max, you had a comment you wanted to make?
Yeah, I'll be super quick. It's definitely a relevant question. Within healthcare, we are faced with a growing and aging population. And within Comox Valley, Strathcona, we're also faced with just an overall increased population within the number of people that we're serving. We absolutely know for us to be able to sustain the publicly funded health system, we have to aggressively grow our services within the community. And we have long-term plans to be able to do exactly that. We will not have constraints around strategically growing our community-based programs and staff and individuals. I think our biggest constraint will be in this post-pandemic era, the scarcity that is national and internationally faced by healthcare in terms of finding professionals to be able to provide those services. So we absolutely have strategic plans with funding to be able to grow community-based programming.
Thanks for that, and I hope that's helpful to the directors. We do now have the recommendation on the floor. It's been moved and seconded. Any further discussion? All those in favor? Are there any opposed? That is carried. And we'll move on to the management report. A motion for receipt, please. Moved by Grant, second by Joliker. Any questions or comments? All in favor? Any opposed? That's carried. We now have bylaws, and the first one is the bylaw number 300, being annual budget, be given first and second readings concurrently. Moved by Grant, second by Wells. Any discussion? Director Joliker.
Yeah, thanks, Chair. And so I don't want to belabor something that I've mentioned before to our staff, but I do find it really challenging from a democratic process when we're considering something as large as a $15 million budget and the bylaws attached to it. And we're being asked to vote not just on first and second reading, but we're also being asked to vote on third and adoption. you know, I spoke to this in other commissions as well. I do find it really challenging when we're in an era where people struggle to participate in our political process, that we then come to one meeting and pass a bylaw in its entirety. I know that it's not unheard of. And I also know that it's not something that is possible if we have a deadline of March 31st for some of these things. So I'm just wondering, two questions. Why is this coming to us for first, second, third, and adoption at once? And secondly, how do we support a process that allows for more space, more public feedback in the future years when we consider the budget and the bylaws attached to the budget?
Mr. Chair, I'll just ask Kevin DeVell maybe to come up and explain the budget process that we currently perform and the touch points that the board has with the budget in normal years and election years and how that may vary. Thanks, Kevin.
Thank you, Russell, through the chair to the directors. So yes, I mean, we do have a clear financial planning process outlined in our financial planning policy. And we do try to provide 3 opportunities to bring the financial plan to the board for its consideration. That first one being that provisional budget that we did present to the board after the recent elections in December. And then if we're able to, we do also try to provide something back to you sometime in February, assuming we do have updates to provide, most particularly with respect to the Island Health annual projects. However, in the absence of that, anything brought forward in February would not yet be finalized and would not include any final determination of prior year surpluses or those capital projects, which is why normally we are bringing it back to you at this time. And you're absolutely correct. Currently, we are restrained by that March 31st deadline, which is why in the hospital district case, we're often requesting that all 4 readings and adoption take place at a single meeting.
Yeah, thank you, Chair. Just as a follow-up to that, are we able to look at our policy to maybe see if next year that we don't have what we have in front of us today, where we're considering first, second, third, and adoption at once? Are we able to space that out so that in February we have first and second, and then there's a month for us to consider, and then in March we would do, you know, and I don't know if that's the right timeline, but just something that is actually a little bit more spaced out so that there is that due process that can happen when we go back to our constituents, folks who are watching this, who are sending us correspondence and might have feedback between that first and second and third. So
thanks, Director. Mr. Dyson.
Yeah, Mr. Chair, we'll bring back for your consideration the policy as it stands, and the board can give consideration to that. And if they wish to tweak it or adjust it, by all means, they can give us that direction. But we'll commit to doing that at the next meeting of the hospital board.
Thanks very much. Further discussion? All right, we'll vote on this first recommendation. All those in favor? Are there any opposed? That's carried. And third reading of bylaw number 300. Moved Grant, seconded Wells. Any discussion? All those in favor? Any opposed? That's carried. And final adoption of bylaw number 300. Moved by Grant. Seconder?
Second.
Seconded by Wells. Is there any discussion? Director Joliker.
Yeah, just not so much I'll be voting in favor of this, but just a question for Island Health for clarity. In the one of the appendixes, it lays out the capital expensive projects. There's a project there that I'm not quite clear if you can kind of share how you see it as a capital expense. The digital strategy, as the description that's been provided to us, it appears that it's more of a corporate strategy than a capital expense. So I'm not sure if I'm missing something in the description there, but I'm wondering if Island Health staff can speak to that and how that fits into this.
Anyone from Island Health? Dave?
I can answer the question. Thanks very much for the question. The digital strategy, it's a strategy for the region. The intent behind it is it's going to establish some central governance structure for digital initiatives and a strategic plan for our core technologies and services. It really supports our strategic goals, and it's really, going to help develop technologies that will, support our patient care and our security around, patient records and, just ensuring that there's better able to serve our patients and ensure the security of their information and information sharing throughout our programs and services as and where needed and required.
That's helpful. Thank you.
You're welcome.
All right, on final adoption, all those in favor? Any opposed? That's carried, and we move on to the recommendation for bylaw number 301, Comox Strathcona Regional Hospital District Capital Expenditures Bylaw 301, 2023. First and second reading moved by Wells, seconded by Grant. Any discussion? All in favor? Any opposed? That's carried. Third reading. Moved by Baker. Thank you for injecting some variety, seconded by Mowini. Any discussion? All in favor? Any opposed? That is carried. Adoption, final adoption moved by Grant. Is there a seconder?
Second.
Seconded by Wells. Any discussion? All in favor? Any opposed? That is carried. And we did have a 2/3 affirmative vote. All right, we now have a new business and the title is the healthcare system. We have correspondence dated January 23rd, 2023 from Lois Jarvis, Richard Hagenson, and Joanne Banks, Citizens for Quality Healthcare, regarding healthcare system issues on Vancouver Island for receipt. Moved by Wells, seconded by Grant, and Director Grant.
I want to bring up something else after this, so I jumped the gun.
If there's time, we'll see.
It'll be quick.
All right. Well, right now we're on the Island Health or the correspondence. Any discussion on the correspondence? I will advise directors that Vice Chair Grieve and staff, James Warren and myself will be meeting with Citizens for Quality Healthcare in Campbell River on Wednesday morning next week to discuss their ongoing concerns related to lab and other issues. Director Jolicoeur?
Yeah, thank you, Chair. I guess I don't have so much of a question of the details of the correspondence, but just curious if Island Health has any comments at this point in response to what we've received.
Does anyone from Island Health want to comment on this correspondence, which addresses a wide range of concerns? Dave?
All I'll say is we didn't receive this correspondence directly, so from our point of view, it would be best for us to take that under advisement and consider a response, if any.
Okay, thanks for that. For further questions or comments? Yeah. Director Jolicoeur.
Maybe some direction from you, Chair, or staff. Is there a ability for us as a board to request the response from Island Health from this correspondence be tabled at our next meeting?
I don't see that as a problem, but we do have a process whereby the chair and vice chair meet with Island Health on a regular basis and are able to review these types of things. You would also be getting a report back from the dialogue that we're going to have with Citizens for Quality Healthcare next week at the next meeting. And I think Island Health would probably be quite happy to provide some response to this at a later date once they've had the opportunity to review it. And maybe Dave, Diane, or Max, you can correct me if I'm wrong on that. Max, go ahead.
Yeah, no, I absolutely want to be able to support the chairs with continued dialogue at the chairs meeting, and we can also bring responses and correspondence back to this group.
All right, thanks for that. So we have a motion on the floor for receipt of the correspondence. All those in favor? Any opposed? That's carried. And thanks very much, directors, for working through the agenda. Oh, sorry, Director Grant, you wanted to bring something up, which we don't actually have on the agenda. We'll give you, since we have a few minutes, we'll let you say what it is and see whether there's a will of the board to consider it.
Oh, here we go. No, I'm just looking at the format of our meetings, and we have a lot of people that Zoom in and some that come in public, and I'm looking down the list of people, and there's several on this list that I wouldn't know if I bumped into them on the street. Some don't buzz in very often, so we don't hear from them. And I'm just like to see if there's a way that we could actually at some point get together as a group and have a meeting, Campbell River or here or whatever staff thinks, that we could actually get to know the group a little better. I don't think it actually leads to really great decision-making when you don't actually know who's on the board. So just a thought, if staff could think of a way to do something like that, even if so, I don't know, but.
Well, I'll take the liberty of saying that that's an excellent thought, and we can certainly consider it. But Director Wally has also raised his hand. Director Wally. Director Wally, did you want to speak?
Thank you, Mr. Chair. We have a roundtable coming up in June in the Campbell River, and I'm sure almost everybody will be in attendance for that one in person.
And Mr. Chair, just to confirm, the roundtables for solid waste, but it does include some of these members. Staff can work with you, Chair, if that won't provide that opportunity for all the health board members to get together, seeking some other option for the consideration of the board, for sure.
All right, thanks very much for those comments and for that suggestion. I think it's an excellent idea, and hopefully we can come up with something. And having said that, thanks again for everyone's participation and efforts, and we'll take a motion for termination. Moved by Mawhinney, seconded by Wells. All in favor? Any opposed? That's carried. Thanks very much. And thanks very much to our